If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411. You're in a good place. I'm Mabel Scott, your Public Information Officer, and today we are talking with Dr. William Stephen Luking, a board-certified family physician. Good morning. How are you, Dr. Luking?
Good morning. Doing well, thank you.
We're glad to have you with us. How long have you been practicing in Reidsville, North Carolina?
Here in the community for 28 years this coming summer.
All right. And the main health issues that you see on a day-to-day basis are?
A to Z. Asthma is A, and zoonosis is Z, infections that you get from animals or other insects, etc. But the run-of-the-mill challenges of the community, physical and mental health, diabetes, hypertension, hyperlipidemia, wellness checks, child checks, vaccinations, mental health issues, and of course, lately, COVID questions and issues, et cetera, et cetera.
And now that you mentioned COVID-19, have you been recommending that your patients get a COVID-19 vaccination?
Absolutely. I'm 1,000% behind the vaccines. It is our way through this mess, and it's our safest way through the mess. I would much rather my patients face some minimal or mild side effects from the vaccines compared to the potential danger from the actual illness by far.
So how has COVID-19 affected your medical practice here in Rockingham County?
I'll try to keep it brief. Over a year ago, my brother and I recognized that we were in for some real challenges. In fact, early in March, we had several weekend sessions where we sat down and spent hours going over all the data that was coming out of the early reports. And we were quite concerned. We knew we had a real challenge on our hands. And so we instituted a majority of interventions. I remember in early March, going down the Tractor Supply on a day off and buying 2 shelters and then hiring someone to help me put them up. Shelters, which, by the way, we would end up seeing sick people in most every day for the past year, and we've used them with quite a bit of improved safety for our patients. Interestingly, 6 months after we established the shelters, I read a journal article about proposing family doctors considered doing that. So we were operating kind of by the seat of our pants. There was a lot of mixed messages out there. More practically on the office setting side, we instituted filters in rooms where doctors would be interacting through the computers, therefore without a mask. We moved quickly to telemedicine in the early weeks to months of the pandemic. Half of our visits were done like this, across a computer or via phone. We stopped wearing street clothes, started wearing scrubs, changed those coming in and leaving the practice. We cracked all the windows. We instituted a filter system in our HVAC and many filters in the rooms, and just did a lot of things to try to protect the patients and try to protect our staff.
That's really a lot that you have to do, and we appreciate what you did, you and your team and your brother, to keep as many people safe as possible. So why do you think some patients are a little hesitant about receiving the COVID-19 vaccination?
So literally we could talk a whole meeting together on that, but briefly, I think anything new and anything even slightly possibly dangerous obviously raises anxieties. That's human nature. I've pointed out to my patients who are reluctant that 200 to 300 people each year in the United States die from penicillin allergy reactions. And yet nobody proposes that I stop utilizing penicillin for my strep throat children or and other important applications. And Similarly, the vaccines are so much more safer. For instance, let me just take a moment and describe the Johnson & Johnson controversy a number of weeks ago. 7 million Americans got the vaccine. And yes, it does look like perhaps 10 to 14 developed a clot complication, although the experts still are not sure whether it was directly associated, but one person did die. But when you think about it, you took 7 million and you immunized them with a vaccine that's highly protective in terms of reducing the risk of serious illness. So you probably save, if you take 7 million looking at herd immunity, probably 4 million infections were saved. And you look at 1% mortality, 40,000 lives were saved by those 7 million taking the steps to protect themselves. And yes, maybe one did suffer a serious side effect, but tens and tens of thousands of lives were saved. So anything we do in medicine, even go in for a hip replacement, it's not 100.0% guaranteed you'll do fine. Everything we do has pluses and minuses, but vaccines are so much more safer than getting the disease.
So when you're talking with your patients, how do you suggest or encourage them to get the COVID-19 vaccination?
So I have to tailor it to the patient. The older the patient is, the more I appeal to their own self-interest of staying healthy and staying on this earth. The younger the patients are, the more I appeal to them to consider their community, their loved ones, their older fellow church members, their older relatives who they might get mild illness, relatively minimal, but they could turn around and give a life-threatening illness to someone they care deeply about. So I challenge them to protect themselves in order to protect others.
Why are some patients really experiencing some challenging experiences if they get COVID?
Yeah. So the jury is still out on a lot of this. I just read an article this weekend about two identical twins with virtually the same health conditions, relatively healthy. One faced a life-threatening, terrible time in the hospital for over a month. The other barely knew they had a cold, and yet these were two individuals who are the most genetically identical folks you can possibly get in the whole world, and yet one minimal illness, the other almost died. So there are still uncertainties and questions, but it does certainly seem that more folks with chronic illness, chronic conditions are more at risk of having a more serious illness, and older folks with diminished immune systems.
And that leads to my next question about pre-existing and chronic illnesses, because I kept reading in so many of the stories and the literature about how many people with those pre-existing challenges, COVID really, it affected them in extreme measures. So we need to deal better with these pre-existing problems, right?
Yes. So the COVID-19 pandemic has laid bare a lot of the shortcomings of the American medical system. We do wonderful, awesome interventional things, but preventive care we don't do so well. We have we train subspecialists that can deliver awesome interventions, and yet when it comes to county, state to state, public health measures have received short shrift, and we've paid a serious price for that. And then on an individual basis, many of us lead unhealthy lifestyles, and we just pop our cholesterol tablet and our blood pressure pill and our diabetes tablet and keep on keeping on. Well, those folks have paid more of a price, sadly, during this pandemic, more at risk. And so, yes, so there are greater questions beyond COVID and greater issues that our society really needs to take a serious look at going forward.
You're saying almost some of the same things that we've heard from Trey Wright, who is the public health director here in Rockingham County government.
Right.
And how so much could be done if we had invested more on a continuous basis with our public health.
Oh, absolutely. And as a family doctor, a large push of my entire career has been preventive and wellness type aspects, which have really received a short shrift in terms of insurers and priorities and And hopefully we'll look at that in new ways going forward. I sure hope. We certainly need it.
So where do we go from here?
All right.
With COVID.
Okay. So before I answer that, I'm going to insert something that I had told myself I wanted to, and that is that this week is National Nurses Week, and this week is also National Nursing Home Week. And I would like to take my hat off to all those who staff the nursing homes and the rest homes and the places of long-term care. They have faced some incredible challenges. And some of those challenges have been publicized, and I can tell you some of them have not. And I think we as a community owe a high level of gratitude to these folks who not only have busted it hard, but really put their self in harm's way early on when we had no vaccines and no way to protect staff members. The work that they've done and continue to do to protect our most vulnerable, tremendous. As for nurses, like so many other avenues of healthcare, the nurses run the show in so many ways, and the kind of things that our own nurses here in the office, but in the hospitals, the ERs, all the kind of settings where health departments where they expose themselves to potentially dangerous situations. Hats off to them in terms of what they have done to further the community's health through this crisis. So I just wanted to get that in.
I think that was excellent. And we can add those first responders,
Oh,
those EMS people,
absolutely,
transporting people to the hospital,
absolutely.
And patients. And it's amazing. These are real, you're talking about saints that are out there helping to save lives. And you're right, they were putting their life on the line to help others.
And since we've shifted gears a hair, let me shift gears a hair more, and then we'll get back to the issue of what to do with COVID from here.
Just go on.
The other gear shift is this. Our state, for reasons that I still find puzzling and frankly saddening, has decided for whatever reason to continue to be rather stubborn and not extend Medicaid coverage to the working poor of our community. And I've had numerous what our community considers essential workers, folks staying with elderly, housebound patients, folks working in grocery stores. We needed to keep eating in the early months when everything else was shut down and many folks were at home and maintaining their safety. I have numerous patients stuck in low-wage income jobs, busting it throughout the pandemic, providing essential services, who if our state had just been wise enough to and humane enough to open up Medicaid expansion to the working poor, they would have faced a lot less challenges. One lady comes to mind, got sick with COVID, likely at the store that she worked at. She had no insurance. I saw her outdoors one day because she had been to the emergency room twice and run up thousands of dollars of bills. She couldn't even speak in full sentences. She was short of breath. Our society somehow found this young woman with 2 children at home to be deemed not worthy of Medicaid expansion when she was out there on the front lines caring for her family, paying her bills, earning a low wage, and somehow rejected in terms of having Medicaid access. So I know she's facing thousands of dollars of bills now, and I know there's many like her across the landscape in our state, and shame on us for allowing that to happen.
COVID-19, have we really moved to the point where we can jump up and down and celebrate? Because some people have started taking off masks and they think it's all over. And what are you saying?
So it's definitely not over. I saw a fella outdoors at the end of last week who had just spent 3 weeks in the hospital with it. He didn't end up on the ventilator, but he almost did. He got it from a grandchild who likely got it at their school. We are identifying new cases every single day. It is not over by no means. It does continue to tail in a somewhat downward direction, although Rockingham County, I'll point the last week, the numbers are actually up a bit compared to the week before. We still have over 1,000 hospitalized in the state with it currently, and 50 in our county. So it's still serious business. It can still take you right out of here. So it's improving. I see a light at the end of the tunnel. I'm not sure what that light represents. I do not think that COVID is going away. I personally think it's going to be a chronic viral presence we'll have to deal with, but hopefully with sensible vaccination, not only for our adults, but for our kids too. I'll point out that Pfizer within the last 24 hours has received emergency approval to vaccinate all the way down to 12-year-olds, and 12 to 18-year-old kids. Most do okay with COVID, but some do very not okay, and they can spread it to others, not to mention the tremendous disruption to a family of having to shut down for a couple of weeks when you have a sick 15-year-old at home. So we're going to try real hard to get the young folks vaccinated. So this is still a work in progress. It's still dangerous. We still need to use our precautions. And yeah.
And so as many of us as possible still need to get the vaccine.
Absolutely. And if you choose a 2 vaccine series, by all means, get the second shot too. Come on.
Yes, go back.
Let's be sensible.
And along with that, are you also saying that we need to continue with the 3 W's? Wear your mask, and then stay 6 feet apart,
right,
and make sure you wash your hands. And a nurse taught me this years ago about how when you wash your hands, you sing that birthday song. And after you do that, your hands will get clean.
That's exactly right. So we have to honor those. And I think some of these things, particularly the self-cleanliness issues and such, are going to be good habits to adopt going forward, even when this thing fades to a baseline, whatever that baseline becomes.
But remember, even before you started going to school, those were things that your parents and grandparents taught you, especially whenever you leave the bathroom, you always wash your hands.
Certainly, I agree.
Yes. So any parting words, anything that you'd like to share right now? The mic is open.
Oh boy. Well, I'm really proud of how the community as a whole has stepped up and done the right thing in terms of looking out after their fellow man and their families, and gosh, the teachers, all that they've done in the schools, all the servants on the front lines, my hat's off to them. All the families that have struggled with illness, the families that have struggled with loved ones sequestered in the nursing centers and not able to reach out to them. It's been a tough year. I think we deserve to extend each other a little bit more grace and a little bit more understanding that we're all in sort of uncharted waters together, and just try to reach out and help your fellow human being, the best you can. Just try to be a part of the community and do what you can to help out.
And we thank you for all that you have done and contributed to Reidsville and Rockingham County, and for all of the special care. And we can tell by your face, we can tell that you really are concerned about your patients. You
Absolutely.
want to do everything you can, because that's really why you became a doctor, right?
That's true. Once again, we could talk a while on that, but you're absolutely right.
Yes, to help others. And that's why we're all here, to help each other. We have a village, and it takes a whole village not only to raise a child, but to keep everybody healthy, wealthy, and wise. So we thank you, Dr. William Stephen Luking, board certified family physician in Reidsville, North Carolina, for all you've done to help to touch the lives of so many people in Rockingham County. God bless you, and we appreciate what you've done.
It's my honor, and thank you so much.
Rockingham County 411, you're in a good place.